PCOS and GLP-1 therapies. 5 things that you need to know. Hi, welcome to Hormones and Health. My name is Dr. Heike. Today we're going to talk about GLP-1 therapies and their role in Polycystic Ovary Syndrome. GLP-1 and GIP therapies, commonly the brand names of are Ozempic, which is semaglutide, and Mounjaro, which is tirzepatide. Mounjaro is a combination of GLP-1 and GIP. These medications were developed for type 2 diabetes and are commonly used in that. However, they are being used in women with polycystic ovarian, particularly to manage insulin resistance, and they have some useful effects regarding that. So here's 5 things that you should know. Number 1, how do they work? They target insulin resistance. And what this does, this drives high insulin levels, weight gain, and excess androgen production. This is because we have a hormone called sex hormone binding globulin, HPG, which are lower in insulin resistance. Thus, you have higher circulating levels of testosterone because the SHBG isn't binding to the androgens, such as testosterone, circulating in the body. GLP-1 therapies improve all of this by helping improve your body's insulin sensitivity and reduce this higher insulin levels, also known as hyperinsulinemia. And thus, it helps to lower the testosterone levels, regulate menstrual cycles. It can also improve symptoms such as the acne and the excess hair growth, hirsutism. The second thing about GLP-1 therapies is that they promote sustainable weight loss. And it's quite widely known that they are very excellent in helping with weight reduction. Again, in polycystic ovarian syndrome, weight reduction will help improve ovulation, improve menstrual regularity, and help with fertility. The next thing to know, these medications are not safe in pregnancy or in women who are trying to get pregnant. However, we know that if you can manage particularly insulin resistance and help with weight reduction, this improves women's fertility. So a lot of clinicians are choosing to prescribe this for patients to help with PCOS, to help with the improvement in insulin resistance in order to regain fertility. And generally, what I would advise my patients is that to have at least a 6 to 8 week washout period and to avoid trying to conceive for at least 8 weeks, which is considered more of a safe period. The reason why is that we only have animal data from clinical studies, and this shows that there is some effects on pregnancies if taking GLP-1 therapies, and we don't have enough clinical data in pregnancy to say that GLP-1 therapies or GIP-1 therapies are safe in pregnancy. Always discuss your plan with your endocrinologist or your fertility specialist. The next thing we need to know is that it improves mood, energy, and metabolic health. Now, some of the problems with PCOS is that the increased long-term metabolic complications and increased risk of cardiovascular disease. Last thing, most importantly to know, is that it's not a substitute for lifestyle. Diet, exercise, sleep remain the foundations. Good nutrition is extremely important. So think of this as a toolkit to kickstart long-term change. That's it for me. Hope you found this helpful. If you did, please like and subscribe and share with anyone who might find it useful. Thank you.